Bismillahirrahmanirrahim. I am Dr. Alishba Rasool, and I will be presenting a critical appraisal today under the kind supervision of Professor Dr. Saira Afzal. The title is Community-Based Social Interventions for People with Severe Mental Illnesses, a systematic review and narrative synthesis of recent evidence. I will be using the PRISMA checklist for my critical appraisal. Abstract. People living with severe mental illness are one of the most marginalized groups in the society. Interventions which aim to improve their social and economic participation are of crucial importance to clinicians, policymakers, and people with severe mental illness themselves. We conducted a systematic review of the literature on social interventions for people with severe mental illness published since 2016 and collated our findings to narrative synthesis. We found an encouragingly large amount of research in this field, and 72 papers met our inclusion criteria. Over half reported on the effectiveness of interventions delivered at surface level, supported accommodation, education, or employment, while the remainder targeted individuals directly. Community participation, family interventions, peer-led supported interventions, social skill trainings. We identified good evidence for the housing first model of supported accommodation, with the caveat that a range of models are nonetheless required to meet the varied housing, employment, and family-related interventions from elsewhere. We found that augmentation strategies to enhance the effectiveness of social interventions by addressing cognitive impairments did not lead to transferable real-life skills despite improvements in cognitive function. We also identified an emerging evidence base for peer-led supported interventions, recovery colleges, and other interventions to support community participation. We conducted social interventions have considerable benefits, but are arguably the most complex in the mental health field and require multi-level stakeholder commitment and investment for successful implementations. I will be using the abstract PRISMA checklist for this. Title identifies the report as a systematic review. No explicit objective, does not specify the inclusion or exclusion criteria, does not mention the information sources and the date when each was last searched, does not specify the methods used to assess the risk of bias of included studies, does not specify methods used to present and synthesize results, gives the total number of included studies and the relevant characteristics of the included studies, presents the results for main outcomes, does not provide limitations of the evidence included in the review, provides a general implementation of the interpretation of the results and important implications, no funding source mentioned, no registration number mentioned. The title is identifying the report as a systematic review, as you can see. Introduction. The high social and economic costs of severe mental illnesses are well recognized, with clear negative impacts on patients, their families, and the wider society. The World Economic Forum has estimated that mental ill health will account for more than half the global economic burden attributable to the non-communicable diseases by 2030. There are major challenges associated with the delivery of effective social interventions to enhance social outcomes in less economically developed settings, including socio-cultural factors such as the availability of family support, the impact of industrialization, stigma, discrimination, inadequate protection of human rights, and limited access to services. Furthermore, there are even greater barriers to providing and researching social interventions in low and middle income countries and higher income countries due to limited availability of the human and financial resources. Given these multiple considerations, we focused this review on the interventions that were clearly social in content and aimed to improve social outcomes, specifically those that included studies conducted in the lower and middle income countries, as well as those from high income countries. Methods. Our search was conducted in July 2020 using the Medline, IMPACE, PsycInfo, Sinahil, and Cochrane databases, and included peer-reviewed papers published between January and July 2020. Our search terms reflected three central concepts: severe mental illness, models of care, interventions, and outcome and experience measurement. We limited our search to publications in English and available in full text. Authors were contacted for the relevant papers if the full text could not be accessed. Results of the original search undertaken for the Victorian Royal Commission were screened using the Providence online software. After duplicates were removed, reviewers screened by title, abstract, and full text. All disagreements were resolved through consulting with the project lead. The Royal Commission review identified 313 papers for the present review and additional 15 papers reporting on studies conducted in the lower and middle income countries, plus 8 hand search papers were included in the giving a total of 336 papers. Publications were selected from these 336 using competence on the basis of the inclusion-exclusion criteria described above. A team of 6 reviewers screened by title, abstract, and full text, with each study requiring 2 yes votes at each stage to be included. All conflicting votes were resolved by an independent third reviewer. Publications were selected from these 336 using confidence on the basis of the inclusion and exclusion criteria described above. A team of 6 reviewers screened by title, abstract, and full text, with each study requiring 2 yes votes at each stage to be included. Primary papers were evaluated by the KMET standard criteria to assess the methodological quality of both the quantitative and qualitative research. We developed a data extraction table and guidance notes to assess consistency in the synthesis of findings from studies in each of the 7 models of care community interventions. One co-author produced a textual summary for each social intervention category, and each summary was then reviewed by both first authors. The textual summaries were then refined and finalized through consensus discussion within the author group. Given the range of models of care and interventions included, we chose a narrative synthesis approach to summarize our findings. This was the Prisma, and it shows that finally 72 articles were included in the studies. Results: we identified 72 studies meeting our eligibility criteria. Over half of the included studies reported on the effectiveness of social interventions delivered at the service level, supported accommodation, supported education, supported employment, and the remainder evaluated interventions targeting people with severe mental illnesses directly. Community participation, family interventions, peer developed, led, supported interventions, social skill training. Narrative synthesis. We identified an encouraging level of recent research evaluating social intervention. We included interventions with a more established evidence base, supported accommodation, supported employment, and family interventions, as well as those at an earlier stage of development. Although we found higher numbers of studies evaluating supported accommodation and supported employment compared to the other interventions, most of which were of high quality, we also identified a growing evidence base for peer-led supported interventions. However, there was a paucity of recent studies assessing the cost effectiveness of interventions. Factors influencing our findings: context, inconsistent terminology, heterogeneity of target population, content of interventions. The aggregation of the findings of the studies we identified was confounded by some limitations, including the heterogeneity in what constituted a positive outcome, the range of measures and metrics used to assess similar outcomes, the use of bespoke tools that lack psychometric testing, the use of varying follow-up periods, and the variation in what constituted usual care in the comparison groups. The majority of participants in the studies were male, and this way may mean that findings are less relevant for women. In addition, when the interventions were delivered alongside assisted mental health services, the latter were often not described at all. This applied particularly to peer involvement studies, limiting generalizability. Further issues common to all complex intervention research include the fact that the implementation of many of the interventions we examined was driven by local enthusiasts and supported by the framework of a research study, and therefore wider implementation may be less successful. Discussion. Our review highlights the value of investment in supported accommodation, supported employment, and family psychoeducation for people with severe mental illnesses, in order to foster their social and economic participation, and provides evidence of positive outcomes associated with peer involvement in the development and delivery of social interventions. Our findings particularly emphasize that social interventions, whether delivered at service level or individual level, need to be tailored to the person and context specific. Our review was wide-ranging in scope and included 7 domains of social interventions that targeted people with severe mental illness. A strength of our approach was the use of narrative synthesis to summarize a diverse range of quantitative, qualitative, and mixed methods research reporting on both the effectiveness and implementations of interventions. However, the difficulties in defining social interventions, as noted in our introduction, may have led to exclusion of relevant studies. Conclusion. Our review identified an encouraging level of interest in research into social interventions for people with severe mental illnesses. Of note, the service level interventions with the strongest evidence, supported accommodation, supported employment, have often been fostered by specific policy and government investment, which has facilitated their widespread adoption and ongoing research, whilst other effective interventions, such as family interventions, have struggled with implementation. Finally, our review identified a number of recommendations for future research in this field. First, a clear definition of what constitutes a social intervention is needed. Similarly, agreement on relevant high-level social outcomes to be reported in studies of different types of social interventions should be considered. Finally, given the limitations of the studies we identified and the influence of the contextual issues, further multi-site RCTs are needed even for the interventions for which we found the strongest evidence. Now, using the PRISMA checklist, introduction mentions the rationale for the review. However, no explicit objective given. Methods. Specify the inclusion and exclusion criteria. Mentions the databases used to identify the studies and mentions the date when each source was last searched. Presents the search strategy. Specify the methods used to decide whether a study met the inclusion criteria of the review, including how many reviewers screened each record and each report retrieved, whether they worked independently or jointly. Specifies the methods used to collect data from the reports, including how many reviewers collected data from each report and whether they worked independently. List and defines all outcomes for which the data were sought. Does not specify the effect measures for each outcome. Describe the processes used to decide which studies were eligible for the synthesis. Describe the method required to prepare the data for presentation or synthesis. Describe the methods used to tabulate or visually display of results of individual studies and synthesis. Describe the methods used to synthesize results and provides the rationale for choice. Results. Describes the results of the search and selection process from the numbers of the records identified in the search to the number of studies included in the review using a flow diagram. Cite studies that might appear to meet the inclusion criteria, but which were excluded and explain why they were excluded. Cite each included study and presents its characteristics. Presents assessments of risk of bias for each included study. For all outcomes present for each study, it does not give summary stats for each group. For narrative synthesis, briefly summarize the characteristics and risk of bias among contributing studies. It does not present results of all investigations of possible causes of heterogeneity among study results. It does not present results of all the sensitivity analysis conducted to assess the robustness of the synthesized results. It does not present assessments of the risk of bias due to missing results arising from the reporting biases. It does not present assessments of the certainty or confidence in the body of the evidence for each outcome assessed. Discussion provides a general interpretation of the results in the context of other evidence. It mentions the generalizability of the findings. It mentions the strengths. Discuss the limitations of the evidence included in the review. Discuss the implications of the research for future practice, policy, and future research. Other information does not provide registration information for the review, including registered name, registration number, or the state that the review was not registered. Does not describe sources of financial or non-financial support for the review and the role of the funders or sponsors in the review. Does not mention any competing interests. Now, what were the strengths of this article? It gives the strong rationale for the review. It specifies the inclusion-exclusion criteria, search strategy brief, and study selection process, mentions the databases and the dates of the included studies, describes the methods required to prepare the data for presentation or synthesis, describe the methods used to tabulate or visually display results of the individual studies and synthesis. It presents the assessments of the risk of bias for each included study. Lists and define all outcomes for which the data were sought. For narrative synthesis, briefly summarizes the characteristics and risk of bias among contributing studies. It also provides a general interpretation of the results in context of other evidence, mentions the generalizability, mentions the strengths, discuss the limitations, and also provides the future research implications and policies. Now, what were the limitations? One more thing I would like to add in this is like that the abstract was quite not well balanced. No explicit objective given, does not specify the effect measures for each outcome. It does not present the results of all investigations of possible causes of heterogeneity among study results. It does not present results of all sensitivity analysis conducted to assess the robustness of the synthesized results. It does not present assessment of the risk of bias due to missing results arising from the reporting biases. It does not present assessments of the certainty in the body of evidence for each outcome assessed. Thank you.